Good morning, good afternoon, and good evening. I want to welcome you to St. Dominica Rehabilitation Limited video, where we focus on behavior modification. Remember, we started this particular video from the motive, that is why we do what we do, and we'll talk about the goal setting behavior, where it was titled effective goal setting behavior. Now we now discuss about motivation. After discussing about the motivation, we now discuss we discover that before an individual motivation need to be visible, there are some objective point of view of that particular individual, where we call that particular topic behavior, and it was titled concept of behavior. Now I want us to discuss in detail what behavior modification is all about. And in this particular aspect of behavior modification, we are going to discuss the following course outline, but may not come in the way you may understand behavior in your own context. So this particular explanation and context that will be, the outline that will be, scheduled will be, culturally related according to your culture. Remember that as a behavior to be okay, to be acceptable or unacceptable, a culture or a structure of a particular setting need to be put into consideration. Then I want us to understand that before you discuss behavioral modification, you have to put the cultural context of that environment into consideration, because you cannot modify behavior against a culture of a place. For instance, the behavior of an individual in Norwegian country, like we call Scandinavian countries, cannot be the same with that of a behavior of people in Nigeria, where we have a canon of behavioral modification. So, for psychological point of view, remember, this is not a therapeutic video, rather it is for motivation and as well for learning. So don't use it as a means of treatment. However, I will discuss about behavior modification. I will also talk about counseling. I'll talk about psychotherapy. And after then, I will also go in detail the principles of behavior modification. So what do you understand by the term behavior or behavioral modification? In modern terminology or literature, we call it behavioral therapy. Behavioral modification is a psychological means of treatment where the goal is to elicit acceptable behavior or desirable behavior and eliminate undesirable behavior. So in this particular definition of behavior modification, remember that the target of behavior modification is targeting towards enhancing those behavior that is positive or enforceable and removing the negative behavior or unacceptable behavior. Remember, in a context that is in a societal context or cultural value-oriented environment. Because a particular behavior cannot suit, of a certain environment might not suit the other environment. So it's boundary oriented, it is territorial, all encompassing. So in application of this behavioral modification, there are things that you must put in mind. That one, it must follow the psychological principles that are essentials in behavior modification. And when these principles are put into consideration, that make it more evidence-based practice. So it must be scientifically based when considering this therapeutic model. Remember, in the definition of behavioral modification, you can also try to tell people that it is a therapeutic skill used by a psychologist in order to elicit a desirable behavior and eliminate undesirable behavior. So you can also say it's also a process of enhancing an acceptable societal oriented behavior and eliminate those particular behaviors that are not acceptable. Behavior modification does not encompass biomedical treatment approach. It is basically psychological. So behavior modification is more of psychological than physiological. So that means in considering behavioral modification principle, the principle of behavior modification must come together with that of learning. Remember that learning or conditioning is what assists an individual to subjectively accept a particular event or experience. So that means behavior modification is psychological in nature. So the management of a particular behavior mustn't be biological, that you must not use medical, pharmacological perspective in modifying individual behavior. Hence, you are going to use the principles of learning or conditioning, which are more of classical conditioning and operant or instrumental learning. So once it is out of this particular model of treatment approach, that means it is no more a behavior modification using psychological perspective. So it's a psychological treatment approach where learning techniques are used as a tool to eliminate unacceptable behavior and increase desirable or acceptable behavior. And in our further discussion, we are going to talk about those operant and the classical conditioning or learning method that will be useful in behavior modification. So as you're listening, keep following, share the video, subscribe. Once you subscribe, more is going to drop. And in our community, we also attend to your questions. If you go down below the comment section, there is no question we have left untouched. So we are to serve you, and we are ready to modify your behavior. That is what I don't do without. I usually end my lecture with thought-provoking question. The question today is, what systematic approach that is used in changing behavior? And this behavior that you're using a particular systematic method in changing, does it comply with the environment where you live, your society? If yes, you're in a good pathway. So is this behavior scientifically verified? This model that you are using, is this scientifically verified? That is it, have you used all scientific methods to elicit a fact? Though you can still research on it if practicable. Another thing I want to ask again is, are you trying to use a particular method of behavioral modification in all conditions? Because I understand that we have different behaviors, so also we have different methods or methodology in treatment of that particular behavior. Okay, you, the counselee, the client, what is that behavior that you cannot manage by yourself? Are you still rationalizing your behavior? Are you still using defense mechanism as a means of hiding your unbearable behavior in order to be accepted in society? Are you camouflaging? That is, cutting the bush and coming out and shout, who is cutting? Is your behavior amenable to those around you? If not, go and plan on how to change that behavior. If you cannot do it alone, consult a therapist. Therapists are there everywhere so that you will receive a model way of behavior modification. So we are going to discuss about counseling and psychotherapy, and I will also tell you where counseling is necessary to be applied and where psychotherapy is necessary to be applied, though they are all tools that can be used in behavior modification. Because in all of this, the core of it all is helping or assisting the client to regain his or herself, or to realize a positive way of thinking, perceiving, and acting. Because there's no how you can remove thoughts from behavior. There's no how you can also remove emotion from behavior. All these things are related. Hence, go and meet a professional and a licensed therapist to assist you. So I want to end this video by telling you those that are very, very proficient or competent in the management of behavioral anomalies, that is abnormal behavior that needs modification. One, psychologist. Meet a psychologist. They are everywhere. You can Google your phone. Some of them run a rehabilitation center. Some of them run behavioral modification clinic. You can also access a psychiatrist or go to a psychiatric hospital. Psychiatrists are okay in behavioral modification skills because they also have knowledge on that. Psychiatric nurses are also of important. These are people, professionals that can play a role in behavior modification. What of guidance and counselors? They are also useful and essential when talking about behavior modification. What of clinical psychotherapists? They are also useful in this area. To an extent, correctional centers are also useful. Social workers, that is psychiatric social worker working in a clinic, they have the tool. Law enforcement agency are also useful in behavior modification. Like for instance, those of addiction, those of violence, criminal, correctional centers, law enforcement agency. So to tell you that even your pastor, your teacher, your father, because once your behavior is structured normally in the family, can also help you well in society. Remember, there are factors that affect behavior, which I have tried to tell you. Peer influence, even the family also, family factor, and the social factors, that is modeling. So in this course, if you know whatever that is good for you in order to behave normal, adjust properly to the society where you belong, do it. Thank you as you follow more of this video. Congratulations. God bless you. Share and subscribe.